It is 11:05. Time for the Dr. Payne Show. Lines already open. Man, we're quick. 416-870-6400 star 640 on your cell.
I don't know what we're talking about.
I don't know. Let's
See,
talk
I
about
said I don't do the show prep from the, as Jody said, the school of Greg. Still hanging around. He doesn't think. You want to talk about medical marijuana or just marijuana in general? Come on, let's go.
Don't bogart.
So I'll give you my opinion first.
Okay.
So I absolutely think it should be legalized. I think there's nothing wrong with it.
Right.
I think there's a danger in how much it's being publicized.
Yeah.
That people who, like you said, have addictive personalities will develop an addiction. And I think there's not enough attention being paid to that. It is still a substance that I've heard people call in, like as I was listening through the week, you have people call in, say, I smoke 6 or 7 times a day, and then, there's nothing wrong with it. It's like, well, you're addicted if you're smoking 6 or 7 times a day. Like if you said I was having 6 or 7 drinks a day, there's an addiction issue. And I think that's a dangerous thing, is the addiction of anything is bad.
You see, but I think that there is also a misconception, because if the government or anyone that doesn't smoke marijuana has the delusion that people that wanted to smoke it haven't smoked it or have a way to get it, then you're crazy.
I think if you're doing it, you're already doing it.
100%.
You see,
100%.
with me, I literally just started to try this out about 6 months ago. And I don't smoke, I don't really drink, so I don't use any drugs at all.
Yeah.
But the whole idea of, because I work out really hard, and I have joint pains and that sort of thing, and a lot of the guys in my jiu-jitsu school will use it afterwards from a CBD standpoint, a pain reduction situation. So I started to try it, and I thought, man, this really helps.
Yeah.
I discussed it with my children. This is not a secret. We have one of the largest platforms in the country here, and I can tell you that I am enjoying it. I think it's a good thing. It's a natural medicine standpoint.
You are a high-functioning individual, though, and there's a difference where it's as dangerous, I think, and I think you're right. There absolutely is a medicinal component to it. In fact, I recommend it to a lot of people that need it from a medicinal component. But, I've also spoken to people who say that they drink a bottle of whiskey every night because that's what helps them with their depression.
Yeah, but alcohol is poisonous.
Well,
you can't give alcohol to a dog or a plant. You will kill it.
You can't give marijuana to a dog. It'll likely kill.
They don't know how to suck air in. Come on, man. What's wrong with
I just saw a post from a friend of mine that a dog that ate the roach at the end of a joint, and they got very, very sick and got THC poisoning.
Really?
So I think there's still, put it this way, there's a whole division of McMaster's Medical School dedicated to potentially the psychological long-term effects of marijuana, things like schizophrenia, and when it's used in excess, and I agree with you with what you're doing, but you are not the average person. You're a high functioning individual who can probably control himself, and if you drank, you wouldn't be an alcoholic, and so I think it's an important thing that. I just think that the conversation around it is making people, and you're right, if you haven't done it, you're not just going to go out and do it all of a sudden. But there does need to be an understanding where we're talking, even on the medicinal side of things, and this is where my expertise lies, is on the healthcare side of things. A lot of the claims that are being made aren't really substantiated either in evidence, right?
They aren't. A lot of it is an anecdotal experience.
Yes, it's case studies.
Yeah, but the reality is that, weed has been the white elephant in the room for the last 20 years. If somebody wanted to get weed, they can get weed.
Yeah, and I agree. I've started by saying I think it should be legalized. I have zero issue with it. The only thing from my perspective with the platform that we have here is I still want to make people understand that anything done to an excessive amount is potentially dangerous, and marijuana is no different.
Yeah, and for me the bigger issue, believe it or not, is the uses of this at work.
Yes, absolutely.
And we have a meeting from HR coming down to our store next week. Now, without having read all the policies and procedures, because we will have a general assembly meeting at the dealership, I think it should be treated like alcohol.
Yes.
You're not supposed to have it at work. You're not supposed to
have it at lunch,
do it at work, at lunch. Whatever you do in your spare time is your business.
Yeah, and I'm part of a lot of committees around the GTA, whether like Humber College, the chiropractic college, these things. And I've said that even with us, when we, from a healthcare professional standpoint, if we see someone who is impaired, whether you're impaired on alcohol or excessive amount of opiates, you remove what's called informed consent. So you need to understand what I'm doing to you.
Yeah.
And so now the conversation becomes, well, what happens? And we were having this conversation over the last 2 weeks, and my stance still is firm that it's based on impairment, right? Because I'm not necessarily not going to treat somebody because they had a beer at lunch,
Yeah,
for
but
example.
because this has been prescribed as medicine.
Not always.
Not always,
Yeah.
but sometimes.
Sometimes, yes.
So you can't penalize somebody that is high at work when they have an actual prescription for them to have it while they're working.
Right, and I agree with that, but that doesn't eliminate impairment. If they were prescribed opiates and they couldn't even stand, you wouldn't let them work because it's a danger.
Yeah, but I mean, it's a little bit different with marijuana than it is with alcohol, because I know some people that are extremely high functioning potheads. They are so
Yes.
high, but you can't even tell.
But that's why But that's why impairment is an individual basis. You can't define impairment for everyone as the same thing, right? Like some people can take 2 or 3 Tylenol 3s and they can same thing. They're high functioning. So it very much depends on subjectively and taking your professional experience to say this person right now is impaired, and that's what we do clinically. If we see somebody and they can handle a drink after when they're coming in for treatment or assessment or whatever, and they had a drink at lunch, that we're not going to not assess them or treat them. But if they're stumbling everywhere and they can't provide that informed consent and they're a danger potentially to themselves, then I think that's where you draw the line.
I think that just to close it and leave you alone, the number one thing for everyone on anything really that involves something that could potentially impair you is just be prudent.
Yes,
If you are a mature, responsible human, you
Yes.
will never get yourself into trouble because you know where the
100%.
trouble is.
I totally agree.
Thank you.
Thanks, Greg.
Phone calls 416-870-6400 star 640 on your cell. Bring them on, Dr. Payne Show. A good start to the show this morning right here on Global News Radio 640 Toronto. It's 11:15. Lots of time for you to call in, ask your questions. You suffer from pain, need some advice, some comments. 416-870-6400 star 640 on your cell. I think eventually all this talk and media attention and radio shows about weed is going to go away.
Yeah, absolutely. And my thing is not to talk about this at length or ad nauseum. It's just simply to highlight the fact that, from a healthcare perspective, that there still is an addiction component to anything. Like, and I'm not suggesting that, marijuana is more addictive than alcohol or something else. That's not my point here. My point is simply just, be careful with what you're doing. Like, be prudent about what you're doing. Make sure that you're thinking about your health too. It's very, very important that you consider, that everything in excess has negative health effects.
Sure.
And so that's my point. I have no problem with people doing it, with, the legalization of it. I actually think it's great. It's the right thing to be doing. And it's no more dangerous than any of the other things that are already legal, which is why I agree. So why not have it be legal? But you're absolutely right. It's just all going to die down and nobody's really going to care. There's, and it is what it is. So I guess, we can change the topic too, John.
I just think a lot of people are shrugging it off and going, it's no big deal because it's something unlike alcohol where it's, it's at the LCBO, it's got a label, it's that whole premise and the way to get a hold of it is different than weed where it's natural. People use that. It's natural. I can grow it in my backyard. I can farm my own. All of a sudden, it's seen as this farm to table, baby spinach. But it's not. Like you said, there's an addictive component to it.
And when it still is psychoactive, right? Like it does still change something about you. Now, some people will be able to handle more. Some people will be able to handle less. And so it's not just oregano or something that you can ingest and it does nothing to change anything about you. This is still something that, there has to be a conversation around impairment of a substance. And just because alcohol is legal doesn't mean that a lot of it is good for you, right? And that's what I'm saying. And there's still people out there that have an addictive issue that are alcoholics, and that's ruined their lives. Mm-hmm. And these people that come through that and are able to manage it the proper way will tell you that substance has ruined their lives. So it's not just all good things. There are bad things to any type of substance like marijuana. So my simple message is this. Again, I have no issue with anything. It's just about being moderate with it, understanding your personality. That's a big thing too, right? Like people who have naturally addictive personalities. You got to be careful because, again, anything that you're going to do too much of might create a problem. But I agree. It'll just die down and the conversation will be done. I mean, nothing changed on Wednesday for you, I,
right, exactly.
whomever. But let's move on to what do you want to talk about, John?
What happened this week at the clinic?
You should do the show prep for me.
That'll be okay.
What happened at the clinic today? So, we see a lot of the knee complaints because of the knee pain or knee clinic initiative that we run where we can get you in quickly. But I mean, I don't think I've seen more knees than I have, for example, shoulders.
Okay.
And so, these are injuries that people have all the time. Sometimes they're chronic injuries. Sometimes they're acute injuries.
Why?
Why what?
So much knee and so much shoulder, do you think?
Because we're human. Pain oftentimes is called the sixth vital sign, right? Because in order to be alive, you sort of have to be able to experience pain. And so, why is there so much knee and shoulder issues? I think because, again, it's related to everything that we do. Like, that's the same question as why is there so much spine-related issues? It is what it is because it's the world we live in. It's the things we do, the repetitive nature of everyone's job, right?
And I guess the nature of the joint too, right?
The nature of the joint, yes. Some joints are predisposed to certain types of injuries versus others are predisposed to other types of injuries. But, I don't think I think, again, we talked about this last week with back pain at how prevalent it is. I think most people know somebody who's dealt with some type of peripheral joint pain, whether it's a knee or an ankle or a hip or your shoulder. And if it's not somebody that it's been yourself. Everyone's hurt themselves somehow, whether it's through some type of specific activity.
Right.
Again, the repetitive nature, I think, of jobs or the things we do in life. And repetitive doesn't mean you have to be doing a motion in order for it to be repetitive. Sitting is repetitive. You're doing the same thing. Anything that you're doing for a long period of time is going to affect your body. And certain people will be more predisposed to a certain issue just based on their morphology, their certain body types. Genetics matter a lot too. Like the things that your parents suffered from in terms of pain are likely the things you will suffer from as well because, genetics is a very, very important thing. But one thing that seems to be consistent no matter what the joint sort of is and we're talking about the musculoskeletal injuries, the soft tissue injuries. You always have to rehab it properly. And that's it's the biggest thing that I see missing in the plans, right? Like I see tons of people come in and they've tried the medications, they've tried the passive therapies, they've tried topical creams, whatever, like everything. And then it's like, well, have you tried good exercise rehabilitation? And the answer is often either no, or if they say yes, my next question, and this is something you're still doing. And it's like, well, no, I did it for like a few weeks. It was shown to me. I did it, here and there, and it didn't really help. It's like, well, of course it's not going to help. If you don't do it consistently, it's not going to change. So more on that when we get back from the break.
Talk about knee joints. See, we're still talking about joints. They might be knees, but we're talking about it anyway. And your phone calls 416-870-6400, star 640 on sale. Plenty of time. You got questions, comments, bring them on. Dr. Payne is here till 12 o'clock. Global News Radio, 640 Toronto. 11:24 Saturday morning. Lines are wide open for you. Have pain concerns, health concerns, need an opinion or a question answered, 416-870-6400, star 640 on cell. You talk about, the one missing link often with people, especially with getting better, getting rid of the pain, or at least not getting rid of, managing the pain.
Yeah.
Is consistent active therapy. My sister-in-law, who came to see you a few weeks ago, about 3 weeks ago, you did exactly that. Do this. Here's your exercise, and do it diligently, do it 3 times a day, and off you go.
Yeah.
Pain is 90% better.
Yeah, and I mean, again, as long as she's okay with us talking about it, which she'll blame you if she's not. The thing that I saw, she did do the passive therapies. Like she did the right thing. She got the meds in the beginning, little haphazard in the use. Same thing. She tried to go for the therapy, which I do recommend in the beginning. Like it is very important. It is part of the treatment plan. But I guess she was a little haphazard with those things, in all honesty. And I basically said to her, like, my biggest thing was when I saw her a few weeks after the show was when I look at back pain, again, what I'm looking for is this 90% of back pain cases, which is what we would term the non-specific mechanical back pain, which is just simply related to muscles, joints, or are we dealing with the 10% of back cases where we potentially have something more serious going on, a disc herniation, spinal stenosis, or then like really rare things like tumors, things like that. I was confident after I saw her that, no, we're dealing with the 90% here.
Right.
And it's pretty easy. That 90% after about 6 weeks, your best hope at managing it is exercises. And she wasn't really doing any, or I guess she had been maybe shown some, but wasn't being consistent with
slacking
it.
on them.
Yeah, and I'm pretty good at being honest with people. And I think most of the patients that have come to see me will say that, yeah, he told me the way it was. Like, and I'll often say, like, I'm about to tell you some stuff. None of it is meant to offend you. None of it is meant to criticize you. I'm just going to give you the right answer here, or at least what we know thus far in our research around pain management to be the most right answer. And I told your sister-in-law, I was like, you got to be doing these exercises. And this isn't something that you do today and then maybe you do it in 3 days from now. It's like, I always try to relate this stuff back to medication because I guess people just understand that better. If you have an infection, if you're diagnosed with pneumonia and the doctor says, here's penicillin, I want you to take it 2 times a day for the next 14 days. If you take a penicillin today and then one in 3 days from now,
nothing's happening.
Yeah, you're going to continue to have pneumonia. Like it's pretty, yeah, exactly. It's pretty simple, right? So there's no difference with what you experience from a pain perspective. It's just that the right intervention is not a pill, it's an exercise. Mm-hmm. Exercise is medicine. Like I need to stress that, yes. that exercise is medicine. It does medicine or a solution doesn't need to come in a pill format in order to be the right one. And exercise is the medicine that physical problems require. And so if you don't do that stuff, you're likely to get stuck. And that's a great example that someone who starts doing, and I mean, if we talk to her, these are not complicated things. This is not like you need this massive facility to be able to do it. No, this is all things that you can do in your house. And in all honesty, in the beginning, you don't need any special equipment. There's nothing. And if you ever do get to the point where you need equipment, you're talking about what? TheraBands, like elastic bands, a ball, like stuff that everybody can get, very inexpensive, but you need to do it. And I always have a portion of my recommendation is exercise based. I saw a gentleman this week who had been having a lot of like spine related pain and these things, and older gentleman, and you know, we went through, and he had tried everything. I mean, everything. I can't even stress how many things he did. He had a list for me of all the things that he did. And all of it was the passive stuff. Like, what can someone else do to me to try to make me better? And I was like, you listen, like 50%. And I always talk to people about, you know, when you're dealing with something, you've got 50%, which is now ingrained in your psychology, which is a totally different topic. But the 50% here, where what can you do from a physical perspective? That answer, when you've been dealing with something for 2 or 3 years, the answer needs to be exercise. And the research is clear. And when I say exercise, a lot of people think, well, I'll go out and do my own. No. Yeah. You still need the professionals. Believe me, the research is clear on this. If it's not guided and graded with a professional, people often fail and don't do the right things because they may do something that they don't understand the full anatomy of what's going on, and they may do something that's wrong for what their specific issue is, and they hurt themselves worse. So it needs to be graded. We've talked about this. Your body adapts to everything. And the simple example is if you're on a weight loss journey and you're starting with walking 30 minutes a day, you're probably going to do that for the first 3 weeks. And you're going to say, yeah, wow, this is working. Like, I've lost a few pounds. This is good. I feel better. Yeah. And then if you keep doing that exact same dosage of exercise, 5-6 weeks later, you're going to say, you know what? I've plateaued. Yeah, I'm not getting any more results. It's like, well, yeah, your body adapts. And so you consistently need to be changing it so that your body prevents, or you prevent your body from adapting. And that's how you have continual achievement of results. And that's what the guided rehabilitation is. And it's also important because, I mean, the rehab that we would give for someone's low back if you're 85 is probably different than if you're 35.
Right, makes sense.
You know, we're gonna have to work within limitations as well.
We'll take a short break. You want to call? You got a question, opinion? We got lots of time. 416-870-6400 star 640 on your cell. Dr. Payne Show, Global News Radio, 640 Toronto. 11:33. Dr. Payne Show, 416-870-6400 star 640 on cell. info@paincarecanada.com to reach out and to get a hold of the good doctor anytime. 1-855-55-Dr. Lou, DRLOU.
Everyone's always surprised because, I mean, my name is Luigi Nally, right? So most people, when they come to see me being on the radio and Dr. Lou, most people are like, I thought you'd be Asian. And I was like,
Why?
I'm sorry to disappoint you.
I thought
Or people are like, I thought you'd be
Asian.
older, thought
Yeah.
you'd be taller, thinner.
Wish I was a
All of
little
these
bit
things. I'm like,
taller.
come on. Like,
Thinner's
I never
nice.
get a compliment.
Yeah.
So when you come see me, at least give me a compliment, please.
Yep.
But yeah.
This therapy, you talk about active therapy and how it's tailor-made for everybody. I mean, there's someone who's going to come in, like my sister-in-law, who's petite and very light, and then we'll have the gentleman that called in, Greg, who's 5'8" and 400 pounds. You're going to treat them very differently.
Absolutely,
Right?
yeah. And I mean, the exercise does need to be different in that instance, right? You also have to take into consideration what people's other, I'll use your favorite word, comorbidities are. What other things do they have going on, right? Because you have to be able to tailor it so that it's not affecting those things. And here's the dangerous thing too, right? So I'll give you like a very, very simple example. Let's take back pain, right? People will often assume like, okay, if we say back pain and we say back pain that has a sciatic presentation, so there's pain shooting down the back of your leg, most people assume, that's a disc herniation. That's some type of disc issue.
Right.
And so the exercise for that is often extension-based exercises. And the problem is not all back pain with sciatic presentation is a disc herniation. And I'm going to simplify it even further. And the opposite of that is something like stenosis, where the exercise would actually be flexion-based. So it's a very dangerous thing when you just assume that all back pain is the same.
Right.
And I'm only using two examples to really highlight a big stark difference between flexion-based exercise and extension-based exercise. And so this, the classic example is like, my mom has leg pain and she brings her knee to her chest and it helps her feel better. And then it's like you've developed leg pain and you start doing that, but you really have a disc herniation and then you wonder why you're getting worse. Mm-hmm. And I've seen a bunch of people. In fact, maybe even your sister-in-law, the person that she had saw, I can't remember, but I think I said, like, I want you to eliminate those exercises. I see people as well that are on exercises and they're doing it. And it's like, you're doing the wrong exercise. You're in fact making yourself worse, right? Like, you can only really consider it exercise if it's helping you. Otherwise, it's just a movement that's worsening. And it's very dangerous. A lot of movements can make certain pathologies worse. Like, if you have a disc herniation and you keep doing flexion-based stuff, you're likely not only are you not helping yourself, you're likely making it worse. And same thing with stenosis. If you do extension-based work and you have stenosis, you're likely making yourself worse. And a lot of times, it's just that simple modification that I see when I see a person that it's like, it seems like you're doing everything right. You're good. You're doing these, your proper dose and frequency, like you're following those things. It just happens to be the wrong exercise. And, and the problem with that is, and they've seen a professional, but again, I've said it's a dangerous thing. Like we often in health have a saying that what is common is common. And it's a dangerous thing, though, to assume that it's always the common thing, right? So if you have back pain and it's like, well, disc herniations are the most common thing, to assume that all back pain are a result of disc herniations. And so if a professional is doing that, that's a problem. You have to make sure that you're not dealing with something else. Although the presentation may seem that way, you have to do the right things to diagnose it. And it's also incredible how many people come in and will say they went to go see somebody and then they were diagnosed with this and told to do this. It's like, well, were you even given a physical exam? It's like, no, I just talked to the person. It's like, come on, like, you have to be able to use your physical exam to rule in and rule out the things you're thinking. And honestly, when it comes to the musculoskeletal issues, everybody's like looking for an MRI or an X-ray. And I mean, we've had surgeons here, knee surgeons, who have said, yeah, the MRI doesn't really give us the information that we really need. It really comes down to a good physical exam. And this is coming from a surgeon. That is very, very important. I had a person this week who came in with, they essentially tore their bicep, right? And we were able to see that very, very easily clinically. We still got them an MRI because they have to go to surgery, but we're not using the MRI to diagnose it. We know it's torn. Like we can see that, we can clinically test it. We're doing it because when the surgeon goes in, they want to know exactly what they're going into. Yeah. And that's an important thing. So, this reliance, I hear a lot of people come in, they have whatever issue it might be, and it's like, they've had it for 3 months. Well, what do you do? Nothing. Well, why not? Oh, I'm waiting for an MRI. Why? Why are you waiting for that? It just means whoever is managing you is not managing it the appropriate way, because a good physical exam from someone who understands these things is likely better than an MRI or some special imaging. Not that that's not important, But why are you waiting? What does waiting do besides create chronicity?
Well, I think when it comes to MRIs, people feel it's this amazing technology that I've had to wait 3 months for, so it's the be-all and end-all to my diagnosis. Right.
And it's not. It's not the be-all, end-all to your diagnosis. A lot of these things, we're often using these special tests because we're like 96, 97% certain, and we just want to eliminate the potential that it's not something else. Now, there are some things where MRIs are diagnostic, right, where it is important to get it. So, I mean, but not like if we're dealing with something like numbness and tingling or some weird neurological presentation, and it's like, well, maybe this person has MS, and you're getting an MRI to look for demyelinating lesions, which are these things that show up on MRIs. Well, that's important. Obviously, you'd want to wait, and that you need that in order to diagnose. But I'm specifically speaking about, like the shoulder strains, the pains in the back and the legs and the feet. Like, you don't oftentimes need these special tests, and the reliance on them is probably hindering a lot of prognosis, because the longer you wait to intervene, the bigger the problem gets and the harder it is to fix. And that's, again, when you're dealing with after about the 3 to 6 months period, the research isn't absolutely clear on when you can define something as chronic, but definitely after the 6 month mark. Some people, some literature will argue after the 3 month mark. But when you're dealing in that realm, once it becomes chronic, remember, you're dealing with another problem, which is the neural pathway of pain, the ingraining of a pathway, right? Like the same way that you were able to learn to write one day, ride a bike, walk, and you're not thinking about it. Mm-hmm. You're learning pain every time you're not doing something about it. Absolutely.
416-870-6400 star 640 on cell. Lines are quiet. If you have any questions, you're confused by any of this, call us. You got some time. Dr. Payne Show, Global News Radio, 640 Toronto. Yeah, pain concerns, health concerns, star 640 works just as well. And we'll get to it. Mike, good morning.
Good morning. How are you?
Good, pal. What's up with you?
Well, at some point around Christmas time last year, I injured myself in multiple ways, training, both shoulders and somewhere along my lower back. Now, I didn't have at that time, and I still don't. I don't have lower back pain. What I have is the pain that shoots down out of my left leg.
Yep.
And periodically numbs my leg depending how I'm standing.
Mm-hmm.
And it hurts to stand, right?
Yep.
So sitting down, I got no pain at all.
Right.
Even for hours, I can fly and drive and no problem. And I went to Buffalo, did some MRIs, and did the whole, panic and rush thing.
Mm-hmm.
My results essentially, I had a slight tear in my left and a slight tear in my right rotator cuff, which both over the course of the last year have seemed to heal. And I did some physio. Now, the pain in my leg hasn't gone away.
Right.
And, it seems like it's getting even longer.
Mm-hmm.
Hurts more anyway.
Yep.
So I really don't know if the exercises I was given are working correctly. And I heard you talking about I may be doing the wrong exercise, which prompted me to call you.
Yeah. So, well, here's the thing that matters first and foremost. Remember, I said the exercise. So when we deal with, call it the low back issues, right? 90% of cases are that non-specific mechanical pain, which is just muscle joint deconditioning type of stuff. And the exercise becomes the solution long-term for those things. There are 10% of cases of low back pain cases where you're dealing with a specific problem. So say something like a disc herniation. That may not resolve just based on exercise. There might need to be other things that need to be done after the chronic point has been set in. So, I mean, if you've got leg pain, then we need to start considering, well, what's putting pressure on that nerve, right? And if it is a disc herniation, then the question becomes, is this a disc herniation that will get better with minimal invasive procedures or non-invasive procedures like therapy, or will it potentially get better with a minimal invasive procedure, or do you need surgery potentially?
Right.
And that matters very much.
Sorry? It is a herniation. That's based on the MRI results.
Yeah, and that's fine that it's on MRI. What I would need to make sure, though, is that it correlates with your symptoms. So a lot of people have disc herniations on an MRI that are not symptomatic or not what is causing their pain. In some cases, yes, it is absolutely the cause, and then that matters because it matters where's the disc herniation, what are the types of exercises or therapies that you've been doing, are they the right things, could you be doing different things? So, I mean, I think you already sort of know because you started off by saying, I think you need to get this assessed properly and start kind of from the beginning and say, okay, well, does the image correlate with what you feel symptomatically? If it is, what are the best answers for that? I mean, I am always someone who tries to go for the most non-invasive procedures. But there are some cases of people that I see where I say, you're going to need surgery if you want, to be better. Now, I'm not suggesting that with you because I don't know. I'm just giving you the way I approach these things. And the answer is not always just exercise. Sometimes the answer does become other things: injections, surgeries, medications, therapies, et cetera, et cetera. And so, with you have a set of symptoms and signs. We need to correlate that with the imaging. We need to assess where you're at, what you've done, what the deficit is or the functional limitations are, and then treat that.
And one quick question. Weight gain. If you go from a certain weight and I injured my shoulder, so I gained some weight while I was trying to recover, and that's where the onset of the pain started for my lower back.
Yeah.
Which prompted me to go get my MRI, and they're saying that obviously that bulging disc, because of my weight gain, that injury may have been there from years ago, but because of the weight gain now, it's pinching on a nerve. Does that make sense?
How much weight?
40 pounds.
I mean, that's not insignificant. There's not a lot of great. It's hard to say. It's hard to say because I'd have to look at you and assess you. Like, it might be the deconditioning more than the weight gain, and usually those two things go hand in hand. But I don't know. Like, how big were you before? Like, what's kind of your body type?
Well, 5'11". I was a big, heavy guy, and then I lost a lot of weight training.
Yeah.
I dropped it down, so I was 280 down to 200 of muscle.
Okay.
I went from 38% body fat to 16 over the course of 4 years.
Yeah.
So I trained properly. I did it right in all diet and proper training. So, then when you get to that certain weight, most people, they sort of, like we all do, we were comfortable with our weight. We just start
of course.
slacking.
Yeah, I mean, it might have contributed a little. It probably didn't help, but is it the absolute root cause? I don't know. It would be very, very hard to say, and probably not likely, but it probably did have a contributing factor for sure.
I should come see you then, shouldn't I?
Yes, you
sir.
should.
All right.
All right, Mike.
Thanks, Mike. Appreciate that. 1-855-55 Dr. Lou, DRLOU, or info@paincarecanada.com to move on and do exactly that. We'll get to more of your phone calls. Joe, I see you there. Hang on, brother. We'll get to you here in the next few minutes. Dr. Payne Show, Global News Radio 640 Toronto. It is 11:52. Couple minutes to go here. We will move onward. Joe, thanks for hanging in, fella. How are you?
Good.
Go ahead.
I have one question for the doctor.
Yes, sir.
I'm 79, 140 pounds, physically fit.
Okay.
I was doing curling with a barbell, which both hands were using. But what I found for some time now, about a month ago, the right bicep. I can no longer do curling because the right bicep is hurting, so I gave up that.
Yep.
I went to the doctor. He said he checked for inflammation via blood test. There's no inflammation. The question is, what's going on?
That's a very hard question. So, I mean, all we know right now is there's no inflammation. That doesn't mean there can't be, another dozen things potentially going on. So I just think it, based on what you're saying right now, I don't think it was a full proper assessment because they've assessed one aspect that might cause pain, but they haven't assessed all of the things that could potentially cause pain in the bicep.
All right.
So
I suggest we make an appointment with you.
Sure, me or anybody that understands this stuff. But I think that is the most important thing is you can't, once you've ruled out one thing, that's great. We now know it's not that one thing. But what are all of the things that can cause that presentation, and how do we rule the majority out where we're left with one or two that are the likely diagnosis? So, yeah, you got to get diagnosed properly. That's the most important thing.
Okay, Doc.
Okay.
I'll make an appointment with you and see you.
Okay, Joe.
Thanks, Joe. Appreciate that. 1-855-55 Dr. Lou, DRLOU is the number. Hey, Gord, how are you?
Yes, hi. Good morning.
Morning.
Morning. A question. I'm reading the result of my abdominal ultrasound. I go to my family doctor once a year for a physical, for blood work, and one of the things includes an abdominal ultrasound.
Okay.
It says that there's a problem with my liver. The term used says here moderate fatty infiltration.
Yep.
And so the family doctor says that there are no pills to make this go away, and he's afraid of in the future potentially of the next stage could be fibrosis of the liver and then cirrhosis, and then I probably could die from.
How old are you?
55.
Yeah, I mean, I know some people in their 30s that have a fatty liver. Now, I'm not suggesting that that's good at any age, but I mean, yeah, I mean, a fatty liver is once the function of the liver starts to be diminished. You know what? You have to understand what the liver does. It's essentially a filter for your body. So if you're doing a lot of things, like, do you drink alcohol?
I'm teetotal. I don't drink at all.
You don't drink at all. Okay, so that's good. You take a lot of medications?
No medications at all.
Okay, and then what's your diet like otherwise? A lot of fatty foods or not necessarily?
Probably a lot of starchy foods.
Okay, well, that might be something to maybe try and change. Like, I mean, usually the biggest things with the fatty liver are, the medications and the alcohols are not going to help that type of stuff. But then, I mean, if all you're really doing, it sounds like you're incredibly healthy, maybe it's just the food matter. I would say try more of the fruits and the vegetables, like the real foods versus the starchy foods. And that may help. Again, nothing is going to eliminate what's already there, but I think you've already nailed it on the head. Your goal should be to prevent fibrosis and then eventually cirrhosis of the liver. And so I think you just might need to clean up your diet in order to, at the very least, slow down this progression.
Sure. I was going to say, too, that perhaps as long as I keep doing this test every year, as long as this thing, shows stability, I might be okay for a while.
Yeah, I don't think I don't know your history, but again, I have actually a couple close friends that have fatty pancreases and fatty livers. Now, again, I tell them that they got to look after themselves, and that's what I'm telling you. And a lot of times, this stuff, if it's not due to other external things like the alcohol or the excessive medications or drugs or anything like that, then the question usually just becomes lifestyle. And so your lifestyle is what your current lifestyle is. So change it around a bit and see if that helps. And I mean, when it comes to detoxing, and I'll use that term loosely, but fruits and vegetables are going to be the most important thing. So that might be an important thing for you to do, is just focus your diet more on those things versus the starchy foods and see if that helps to keep it stable.
Sounds pretty good. I really appreciate your help.
No problem, Gord.
Thank you.
Thanks, Gord. And again, moving forward, 1-855-55 Dr. Lou, DRLOU, and info@paincarecanada.com. Diet's a big issue. Diet's part of it, right?
Lifestyle.
Yep.
Lifestyle is a big issue, yes. And even for Gord, if you're still listening, another thing that I should have probably asked about is exercise, right? Mm-hmm. The research is pretty clear. Moderate physical activity 3 to 4 times a week is what is found to be best for health.
Love it.
That's it. And moderate physical activity at 55 can be achieved by a brisk walk, doing gardening. This isn't something, you don't need to be in a gym for 6 hours.
Olympic weightlifting.
Olympic weightlifting to achieve this. This is, in fact, some research suggests that stuff is actually bad towards your health. And it's very much that moderate physical activity 3 to 4 times a week for 30 minutes a day. That is very, very important. And so that's another thing that should be included. But a lot of these things come down to lifestyle. Yeah, absolutely. And not the easiest, but 2 big components of lifestyle are diet and exercise. And again, this is not rocket science. Like, a lot of people follow a lot of different diets and things like that. But in general, moderate physical activity 3 to 4 times a week for 30 minutes, and a diet mainly based on the real foods, fruits, vegetables, limiting the meat intake, limiting the carb intake. Now, a lot of people will swear by the keto diet and all those things, or a vegetarian diet. Fine, whatever works for you. But in general, like when we look at the research, it's just about being moderate. Yeah. And we know that the things like the fruits and the vegetables are really good for you, and meat potentially isn't as good. So limiting that, and then limiting the complex carbs and the sugars is probably a good thing as well. So, I mean, in general, if you're looking to get a little bit healthier, that is what you should be doing.
Done until next weekend. Want to reach out to make an appointment and chat a little more? 1-855-55 Dr. Lou, DRLOU, and email, of course, always works. info@paincarecanada.com. Till next time, Dr. Payne Show, Global News Radio 640 Toronto.